Mental health of African American men and boys is another topic that will be discussed at the Naomi Ruth Cone Mental Health Conference on May 31st in Evanston. Reginald Richardson is with the Family Institute at Northwestern University, and you're going to lead a discussion on that very topic.
I am. We're hoping to really challenge the participants to think about the issues that confront African American boys and men, what I call really a response to a crisis. We feel that African American boys particularly are under a significant stress that leads to mental illness in our community, and so we're going to talk about some of those factors that create that crisis and to challenge the participants to think about what we can do about some of the factors that have created what I call this crisis.
Mm-hmm. What are some of the factors?
Well, if you look at some of our statistics, we're more likely, African American boys and men are more likely to be represented in the juvenile justice and criminal justice systems. When we look at what's happening in many of our families, about 38% of African American boys will spend at least 60 months with a single parent. We have good data that suggests that single parenting is a risk factor to things like greater instances of substance misuse, delinquency, and other factors because of the loss of the ability of two parents to sort of supervise children and those sorts of stressors that single parents find themselves under. Some of the other issues that we'll talk about is the overrepresentation of African American boys in special education programs, mostly for behavior problems versus true learning disabilities, for example. African American boys are 2 times as likely as their white counterparts to be suspended or expelled from school. So we want to address that issue as well. Another major issue that we've seen over the last 20 years is a significant increase in African American boys committing suicide. Historically, we would have thought that African Americans as a population have historically not been one of the major groups that have been affected by suicide. But with this 146% increase, African American boys between the ages of 15 and 19 has really seen that kind of increase. We need to address these issues. That's the crisis that I'm talking about. Along with this increase in suicide rates, some of the studies also tell us that even when you control for things like social economic status, that doesn't seem to make a difference in this population in terms of the issue of suicide. So those are some of the crisis areas that we're going to focus on and try to really discuss that, and then to come up with some recommendations both from the professional community as well as advocates and others who typically attend this very fine conference.
So you'll have both professionals and consumers participating in your discussion group.
Absolutely. That's one of the reasons that the Family Institute is one of the sponsors, and particularly why I'm interested in this foundation and their work, is because there is this connection between professionals and consumers, and this conference represents a wonderful opportunity to bring those two groups who often don't come together in this kind of learning atmosphere to learn from one another.
Well, tell us about the Family Institute and how is it connected with Northwestern?
Sure. The Family Institute has been organized since the middle 60s to really strengthen and heal families from all walks of life through clinical services, where we have more than 70 therapists who provide individual, group, family therapy, working with couples through our work with Northwestern. We're an independent affiliate of Northwestern, where we have a Master's of Marriage and Family Therapy degree program. We also have a Master's of Counseling and Psychology, and we train students in those 2 programs. We also provide professional and continuing education to professional individuals as well. We're involved in research, cutting-edge research in the area of depression, anxiety, and then finally we have a extensive community outreach program where we provide services to 13 community locations, mostly in schools here in Evanston and also in Chicago, working school-based mental health services.
Reginald, you mentioned some of the consequences of what's happening among African-American young men and boys. What can be done and should be done to counteract some of those consequences?
Yeah, I guess the first thing is this idea of information. You know, if you would talk to individuals, this idea that there is a crisis might not be in the forefront of everyone's mind. So one, we have to get information out. I think secondly, we have to look at the underlying factors that create this sort of idea around mental illness. In the African American community, typically, there is a strong stigma about asking for informal help. Typically, we kind of focus on the informal help. We might go to our religious leaders and those sorts of things, but we've not really focused very much of interventions in these sort of informal kinds of or formal kinds of situations. So that's one, information. Again, I want to say again about this conference, that's where I think it adds a wonderful atmosphere to provide information on the various topics that other guests have already talked about. The other issue, I think, is sort of the marginalization that African American boys experience today. African American boys are, teenagers particularly, are the least hired, yet they participate like any other boy in sort of the desire for the American dream. They will watch sporting events and they will see the successful athletes do quite well and to sell the top gym shoe and whatnot, and all of the sort of spoils of that kind of profession. And so the access to that kind of resource is not always prevalent in some of the African American communities. So I think dealing with that marginalization. Also the issue of meaningful work. You know, one of our previous guests already sort of talked about what Freud said about the importance of work, and I think that in many communities of color, the idea of productive, useful work has not really been as satisfactory as we'd like to see it. So those are some of the issues I think that we would begin to talk about. The other is that I think people who are in the professional arena, you know, African Americans represent about 13% of the population. But in terms of professionals, African American professionals in mental health, only 4% of them are social workers who are African Americans. 2% of psychiatrists and psychologists are African Americans. And so this idea of stigma and access to mental health services, I think, is a barrier when people you might go see don't look like you. Mm-hmm. So there's not the cultural context that is prevalent that I think acts as a barrier to access to mental health services.
How did you happen to get into this field?
I think that on the day of my birth, I was a mental health professional. The role that I played in my family and as I was growing up was one that sort of was always curious about why people did what they did. Mm-hmm. And so even in my family, I sort of was the one to kind of try to figure those things out. My brother was a curious person. To me, why he did some of the things that he did. So I think that prepared me to begin to think about it in a much more analytical way, and then wanting to create for others the opportunity I had as a child. I had great mentors, great parents, and so I wanted to sort of be able to give sort of that kind of experience back, and so I sought this profession in which to do that.
And what did you do before you were with the Family Institute? Well,
I was a full-time academic. I taught at the University of St. Francis in their Department of Social Work. So I was training the next generation of social workers to sort of take on the fight to deal with some of these issues that we've been talking about today.
Mm-hmm. Do you find that addictions are more prevalent among the African American community in men?
Absolutely. Actually, the statistics suggest that it isn't. The rate of addictions is about the same. The access to treatment, however, is different, and the method of drug of choice is different. We're seeing a resurgence in the drug heroin, which historically had been sort of declining. In the 80s and 90s, we saw the use of crack cocaine. That's changing, and so the treatment availability for now heroin is not as great as it needs to be, and so the access to services, the identification of those who are suffering from substance misuse disorders isn't as prevalent.